Based on this 50-year-old female patient's actions and appearance, I would suspect that she is suffering from schizophrenia. Schizophrenia may include positive or negative symptoms. One of the positive symptoms can be the exaggeration of normal functioning. Delusions or hallucinations are classified as positive symptoms. Delusions happen when someone has beliefs that are not true and not usually based on reality. This woman was screaming obscenities at a nearby jogger, which meant that she might have been having delusions that the jogger was harassing her or harming her. The patient also showed signs of possible hallucinations because she was accusing the EMS team of stealing her purse. And some of the negative symptoms that may occur with schizophrenia might include disorganized thinking or speech, unfriendly or rude speech, social withdrawal, apathy, abnormal motor behavior, anhedonia, which is lack of the ability to experience pleasure, and an inability to function normally. This woman also was displaying signs of the inability to function normally, which included the lack of her personal hygiene, through her appearance of dirty clothing and smelling of urine and body odor. If schizophrenia is not treated, patients may suffer from short or long-term health risks that can affect one's life and those around them drastically. These can include suicide or thoughts or attempts of suicide, depression, self-injury, anxiety disorders, obsessive-compulsive disorder, social isolation, homelessness, legal or financial problems, medical or health problems, aggressive behavior, which is less common, being victimized, drug, alcohol, or tobacco abuse, and the inability to attend school or work. This patient's hands might have been shaking because she was experiencing disorganized or abnormal behavior, which is one of the symptoms of schizophrenia. Some of the other behaviors that can be related to this symptom can include resisting instructions, lack of response, unusual posture, and useless or uncontrolled movement. This patient was also showing signs of confusion and combativeness. This might be due to the possibility of her having delusions that she thought she was being attacked or harassed by those around her, including the jogger and the EMS team. And this is also why she thought that they had stolen her purse. She was very disorganized, disoriented, and confused, which are all symptoms of schizophrenia, because she doesn't completely understand what was going on in the situation, and she was separated from reality. This patient will need to be assessed by receiving a physical examination to rule out any problems that may be causing her to possibly have symptoms of schizophrenia. She will also need to have a number of tests and screenings performed, which might include a CT scan or an MRI or screening for drugs or alcohol. She will also need to have a psychiatric evaluation performed by a doctor or mental health professional, which might include using the criteria found in the Diagnostic and Statistical Manual of Mental Disorders, which was published by the American Psychiatric Association. The treatment for mental health disorders is most successful with the use of both somatic treatments and psychotherapeutic treatments. Somatic treatments may include electroconvulsive therapy, drugs, and other brain-stimulating therapies. Psychotherapeutic treatments may include any of the following: psychoanalysis, interpersonal therapy, supportive psychotherapy, cognitive therapy, behavioral therapy, and psychodynamic psychotherapy. Mental illness should be treated with the same importance as physical illness is treated. However, history has shown that mental health is not classified as a physical illness or given the same importance. We see this displayed in the fact that mental health care is often difficult to receive treatment for because of the inadequate coverage from insurance companies. The main reason that consumers say is the reason for not being able to receive proper treatment for mental illness is due to cost. A national study that was performed found that in 2015, behavioral health care was covered as an out-of-network service 4 to 6 times more than medical or surgical treatments were. The study also found that insurance companies paid primary care providers 20% more than they paid mental health care specialists for the same types of care, and that each state has different requirements for health insurance agencies to classify behavioral health as out-of-network. This study proves that insurance companies, employers, and regulators make it difficult for mental health care patients to receive the treatment that is needed. In 2008, a law was actually passed called the Mental Health Parity Law, or Federal Parity Law. This law requires that insurance companies treat medical and behavioral health and substance use disorder with equal coverage as they would provide for medical and surgical coverage. This includes the cost of copays and the number of visits allowed annually. This law applies to most Medicaid policies, employer-sponsored health coverage, children's health insurance program, and coverage purchased through health insurance exchanges. However, the law does not require that all health insurance companies offer mental and behavioral health and substance use coverage. So, insurance companies are striving to provide equal coverage to medical and mental health. It's just a slow process. There are also mental health providers that choose to not accept insurance, and they would rather be paid directly from the client. This can also be a financial burden on the patients that are seeking help for mental illnesses. The bottom line is that those that are seeking treatment for mental illness still have to deal with insurance companies, jump through loopholes, spend time on verifying coverage, or spend a great deal of money on seeking treatment. Hopefully, insurance providers will become more aware of the need to support mental health treatment as equal to medical and surgical treatment. There are many people that suffer with mental illnesses that often don't seek the help they need for many different reasons. However, if the insurance world becomes a better support, we may find more people seeking help in the future.